You said you're for Medicare for all. I want to talk about some of the issues in the campaign. You're for it, but isn't Kamala Harris, who's also running for president, right when she says that means doing away with private insurance?
I don't see why it requires that. I mean, after all, if the framework we're using is Medicare, a lot of people who have Medicare also have Medicare supplements, Medicare Advantage, something like that. There can be a role for the private sector, but just leaving people...
But you're for a single-payer system, aren't you?
I think so. I think that's the right place for us to head as a country, and we can debate the finer points of how to get there. But I've been in countries, look, I studied in the UK where there's not only single payer, there's nationalized medicine, which we're not calling for. Even there is a role for the private sector. I just don't believe that leaving Americans to the tender mercies of corporations is the best way to organize the health sector in this country.
But in single payer, you would be replacing private health insurance.
Yes, at least as again, Medicare for all is the best framework, right? So if we want to make Medicare available to everybody, whether it's as a public option to buy in or simply establishing that as how the payer structure works in this country, that's going to be the center of gravity. And the bottom line is we need to make sure that every American is able to get health care.
How are you going to sell that? When President Obama, and he didn't get rid of all private health insurance, he said, if you like what you have, you can keep it. He was scorched by those who couldn't keep their plans. You'd have single payer. Eventually, that would mean doing away with everyone's plans. How can you possibly sell that in this country today?
Well, you have to make sure that it leads to better results. And if we need a gradual way to get there, then we can start with Medicare for all who want it by making some version of Medicare available on the exchanges for people to opt into as part of the pathway to Medicare for all, so that you can try before you buy, so to speak, as a country. Look, there are a lot of ways, and in the course of this conversation, we're going to get into a lot of the different frameworks that are passed to this. But the bottom line is most citizens in most developed countries enjoy access to this kind of health care, and Americans don't. It's wrong. And one very interesting thing when you talk about the experience in the Obama years is the short amount of time in which ACA went from a political loser. I mean, I remember what it was like to be a Democrat in 2010 as those town halls happened. And by 2018, it was perhaps the winning issue for Democrats, because when we saw what those steps actually meant, when we saw how they made our lives better, we realized that all this crazy conspiratorial talk about death panels or the horrible things that will happen if we don't make sure there's a big corporate role in our healthcare system, a lot of the things we're being sold actually come to pass in the real world.
Let's talk about foreign